and welcome to the Policy, Training, and Enforcement section's video on wound care in adult foster care group homes. We hope you find this information helpful. After this training, you should have a better understanding of the basic terminology and definitions utilized in wound care, the types of wounds you may be exposed to and their causes, signs, symptoms, risk factors, and treatment options, facility, resident, and consultant education to better understand the wound care process and best practices, and finally, questions AFC facilities may be asked during investigations. First, we will go over some of the basic terminology used in wound care. The Braden scale is a scale developed to help health professionals, especially nurses, assess a patient's risk of developing a pressure ulcer. A certified wound specialist is a board-certified formal recognition of a master level knowledge and specialty practice in wound management. A skin assessment is documentation of a patient's physical condition through careful inspection of the skin and general body state. A skin inspection is an assessment of skin color, moisture, temperature, texture, mobility, and turgor or elasticity, and skin lesions, which are damage or abnormal change. A dressing is a sterile pad or compress applied to a wound to promote healing and protect the wound from further harm. A Jackson-Pratt drain, or JP drain, is a closed suction medical device used as a post-op drain for collecting bodily fluid from surgical sites to prevent blood or other fluid buildup in a closed space, which can cause disruption of the healing process or become an infected abscess. A hemovac drain is used to remove fluids that build up in an area of the body after surgery by creating suction in the tube. A negative pressure wound therapy is a vacuum-assisted therapeutic technique using a suction to remove excess exudate and promote healing in acute or chronic wounds and second and third degree burns. Offloading heels refers to minimizing or removing weight placed on the foot to help prevent and heal ulcers, particularly those caused by poor circulation to the feet due to diabetes. Moisture management is the first step in treating moisture-associated skin damage. Dressings, external collection devices, barrier creams, underpads, etc. can all be used to help absorb moisture and prevent it from soaking the skin. A skin tear is a traumatic wound caused by mechanical forces such as shear, friction, or blunt force, or the mechanical force required to remove adhesives. Moisture-associated skin damage refers to a skin injury characterized by the inflammation and erosion of the epidermis due to prolonged exposure to various sources of moisture and potential irritants, such as urine, stool, perspiration, wound exudate, and ostomy effluent. Incontinence-associated dermatitis is inflammation and/or erosion of the skin after exposure to urine or stool. Malnutrition refers to a lack of proper nutrition. This is a factor that can inhibit proper wound healing. Maceration is the softening or breaking down of the skin due to prolonged exposure to moisture. Staging is an assessment system that classifies pressure ulcers based on anatomic depth of soft tissue damage. This is completed by trained professionals. A pressure injury, which includes pressure ulcers, pressure sores, and bed sores, refers to tissue damage that develops because of pressure over a bony prominence or related to a medical or other device. It is caused by pressure or a combination of pressure and shear. An avoidable pressure injury means that the facility did not do one or more of the following. First, evaluated clinical condition and pressure ulcer risk factors. Second, define and implement interventions that are consistent with resident needs, goals, and recognized standards of practice. And third, monitor and evaluate the impact of the interventions or revise the interventions as appropriate. An unavoidable pressure injury means that the facility evaluated the resident's clinical condition and pressure ulcer risk factors. This includes defining and implementing interventions that are consistent with residents' needs, goals, and recognized standards of practice, monitored and evaluated the impacts of the interventions, and revised the approaches as appropriate. Debridement refers to the removal of dead tissue. Irrigation refers to the steady flow of a solution across an open wound surface. It is done to give the wound hydration, remove deeper debris, and assists with visual examination of the wound. A wound culture is a lab test in which microorganisms, such as bacteria or fungi, from an infected wound are grown in the laboratory on a nutrient-enriched substance called media. Then the microorganisms are identified. Next, we will discuss wound types and stages. An acute wound heals in a predicted amount of time with no complications. A chronic wound takes longer to heal than predicted and has some complications. Next, we will be discussing ulcer types. A pressure ulcer can lead to sepsis, has nociceptive pain caused by tissue damage, and is a neuropathic dysfunction of the nervous system. Arterial and venous ulcers often form on the lower extremities, such as the legs and feet. Arterial ulcers develop as the result of damage to the arteries due to the lack of blood flow to the tissue. Venous ulcers develop from damage to the veins caused by an insufficient return of the blood back to the heart. For diabetic ulcers, foot ulcers are a common complication of diabetes. They are caused by poor diet, exercise, and insulin treatment. Continuing on with discussing wound types and stages, a suspected deep tissue injury has an unknown depth and usually starts by looking like a bruise. We will also discuss the stages of pressure ulcers. Stage 1 has beginning redness. Stage 2 is an open wound. Stage 3 is a deep wound. Stage 4 has tissue loss. And an unstageable pressure ulcer has tissue loss and its depth is unknown. We will now discuss skin tear types. The first type includes no skin loss, and a skin flap can be positioned to cover the exposed wound base. The second includes partial loss of the skin flap, and the third includes total loss of the skin flap and the entire wound bed is exposed. The following listed on this slide are some causes of wounds, although it should be noted that the causes are not only limited to these items. First, unrelieved pressure from beds, chairs, wheelchairs, etc. Second, excess moisture from fecal, urinary incontinence, wound drainage, etc. Third, poor nutrition and/or hydration. and finally, generally poor health. Wound signs and symptoms include the following: pain, redness that does not change over time, swelling, bleeding, pus, drainage, fever and/or heat in the area in cases of infection, and worsening blisters. Next, we will discuss wound risk factors. Risk factors include limited mobility due to surgery, coma, sedation, paralysis, bed rest / use of wheelchair, or general weakness. Decreased sensory perception, medical conditions that affect circulation of a weakened immune system, commonly diabetes, neuropathy, and heart disease, decreased mental awareness, children and the elderly, cigarette smoking, alcoholism or addiction to narcotics, and living in hazardous environments or having dangerous jobs.
Treatment options should be consulted with the patient's physician and may include some of the following: frequently repositioning the patient off from pressure points, routine cleaning and removal of damaged tissue, clean and dress the wound, vacuum dressings, keeping the area warm to increase blood flow, oxygen therapy, and specialized dressings, antibiotic and pain management, improve nutrition, calories, protein, amino acids, water, vitamins, and minerals. Our next topic to discuss is facility education. Let's talk about how a wound heals, specifically moist wound healing. Keeping the wound site or wound bed moist allows healing to happen more efficiently. If the wound site is dry, new cells can't travel across it as well. A moist wound site allows the cells to move across the wound more efficiently. A wound bed that is too moist will hinder the healing process because it can flush away new cells. Keeping the wound covered with a sterile dressing also prevents contamination. Our next discussion is the type of wound dressings. The type of dressing used is recommended by the patient's doctor. The type of dressing depends on the type of wound. Gauze and occlusive dressings are the most common types used and can be purchased over the counter. Occlusive dressings are considered the best type for maintaining a moist wound bed or for keeping the antibiotic creams on the wound. Other dressing types include compression dressings, biological dressings, chemical debriding agents, and calcium alginates. These dressings are typically done by prescription only and are usually applied by a medical professional. Here are some tips for preventing infection. Always wash your hands before assisting with a wound patient. Remove any rings from your hands and scrub your hands with soap and hot water for at least 30 seconds. Sterile gloves can also be worn. Signs of infection include redness and swelling around the wound, fever, and increased pain. If you notice signs of infection starting to set in, contact the patient's doctor. Here are some tips for cleaning the wound. A saline solution is considered the best product for cleaning a patient's wound. Doctors will sometimes prescribe a special antibiotic treatment in addition to the saline. The saline solution should be applied around the edges of the wound, with the liquid allowed to drain over the wound. Avoid spraying the solution directly on the wound because this can tear the wound or wash away the healing cells. The next point of discussion is bathing a wound patient. If the patient has sutures or exposed bones, the doctor will likely advise against getting the wound wet. Normally, a patient can bathe or shower if the wound is not exposed to water under pressure, such as a whirlpool or spray from a shower. If a patient is unable to bathe him or herself, a sponge bath is recommended. If a patient has difficulty keeping the wound area away from the stream of water, the wound area can be covered with a plastic bag to keep it dry. Nutrition and wound care is the next topic. Poor nutrition can dramatically slow down wound healing. Proper nutrition that includes plenty of protein are essential. A well-rounded and healthy diet can help a patient's body generate new cells to heal a wound and can also help fight infection. Preventing pressure ulcers is important. Watch for pressure ulcers. They can develop in patients who are restricted to wheelchairs or a bed. Check skin surfaces daily, and if possible, help the patient to regularly change their position. The doctor can also recommend light stretching exercises for non-wounded areas to help improve the patient's circulation. Skin moisturizers will keep the skin nourished and can help prevent pressure ulcers from forming. Work closely with the patient's doctor to help care for wounds. Following the doctor's advice is the best way to ensure the wound healing progresses smoothly. The next section is information to share. Resident education. Wound prevention and care can start with resident education. Share the following with residents. Manage chronic conditions. Eat a well-balanced diet and drink plenty of fluids. Inspect skin regularly. Avoid trauma to the skin when shifting positions, such as lifting and turning rather than scooting or dragging the skin. Prevent trauma with proper shoes and clothing, and seek immediate care if a cut or wound does occur. Prevent wounds by following safety measures, paying close attention when handling sharp, corrosive, or hot items. Keep the skin clean and dry. Consider a tetanus shot or booster, especially in cases of human or animal bites or dirty wounds. Have injuries or wounds monitored quickly, especially if you are a high risk. The next section we'll discuss is licensing consultant investigation, investigating allegations in adult foster care homes regarding the following: lack of care, care causing residents to obtain wounds, lack of adequate wound care being provided. In the following slides, we'll dive deeper into the questions that are asked during investigations concerning identification, prevention, intervention, care, and treatment. During an inspection, the licensing consultant will identify how the resident's skin is assessed and how often, also where it is documented. What, when, and to whom are changes in skin condition reported? How are staff made aware of the resident's daily care needs? What happens if the resident refuses care? During the inspection, the licensing consultant will look at prevention measures that are in place. Are reusable dressing care equipment, such as the bandage scissors, cleaned between uses? Is the resident at risk for the development of pressure injury? What interventions were in place before the pressure injury developed? Are clean wound dressing supplies handled in a way to prevent cross-contamination, such as unused supplies are discarded or remain dedicated to one resident? The licensing consultant will review intervention measures. Are ordered nutritional interventions implemented, such as supplements and hydration? Does the resident have pain? If so, how is it treated? Is the resident currently on any transition-based precautions? How does staff monitor the resident's wound progress? Are interventions and preventative measures for wound healing being used, documented, appropriate, monitored, evaluated, and modified as necessary? If the resident refuses or resists staff interventions, are there efforts to find alternatives to address the needs identified? If there was a significant change in the resident's status, did the facility complete a new plan of care? The licensing consultant will review the care plan. Does the care plan identify needs, measurable goals, resident involvement and choice, and interventions to heal or prevent pressure ulcers, such as pressure relief devices, treatment, and repositioning? Has the care plan been revised to reflect any changes in pressure injury? How are staff following the care plan? When did the current pressure injury develop? What caused the pressure injury? How is other staff and the physician updated on the status? How is staff monitored to ensure they are implementing care plan interventions? Was a baseline care plan in place on admission? The licensing consultant will also review treatment plans. Is the wound care performed in accordance with the physician's orders and care plan? What is the current treatment ordered by the physician? How often are dressings changed or treatment applied? How is pain related to pressure injury assessed, and how often? How is the effectiveness of wound care or pressure ulcer prevention measures evaluated, and how often, and by who? How did staff involve the resident in decisions regarding treatments? Has the physician-ordered treatment been evaluated for effectiveness, modified, or changed as appropriate and/or as needed? Here are some helpful sites to explore to gain further knowledge and information concerning wound care. Thank you for watching our video, and we hope that this information on wound care in adult foster care homes has been helpful. Our first priority is the care and safety of the residents, so please don't hesitate to reach out to your licensing consultant if you have questions.